Does root canal treatment weaken my teeth? Hi, it's Dr Michael Ghobrial here from Shaw Dental, Wavell Heights in Brisbane. Now, one of the saddest things I hear from some of my patients is, Michael, I had a root canal done, but my tooth became weak and it broke a few years later, and it all felt like a big waste of time and money. And this raises a very important questions. Do root canal treatments weaken teeth? Now, let me share some insights to help you understand this complex question better. Now, when a tooth needs a root canal treatment, it's usually because the nerve inside has become infected or necrotic or irreversibly inflamed. And by the time the tooth reaches this stage, it's often endured a history of large fillings, decay, or trauma that makes it compromised to begin with. Now, the process of root canal treatment can also affect the internal strength of the tooth, which is why it's crucial to approach it carefully. Now, in the past, when I was at university, just a couple of years ago, of course, we were taught to remove a significant amount of internal tooth structure to create a straight line access and ensure that we get effective disinfection. However, we now know that removing too much internal tooth structure weakens the tooth considerably. So today, we use micro-preparation techniques that preserve as much of the natural tooth as possible. This makes the procedure more technically challenging and requires specialized equipment, such as microscopes, thin instruments, as well as CT scans for precision. Now, at Shaw Dental, for more complex root canals, we work closely with expert root canal specialists who use these advanced methods to reduce the weakness of the tooth structure. Also, another important factor is that after the root canal treatment, the tooth loses its nerve, which means it no longer provides live feedback to your brain as to how it's being loaded during chewing. This can make the tooth more prone to being overloaded and therefore more susceptible to fracture. And this is why, especially for back teeth or teeth under significant stress, we typically will place a crown or a ceramic onlay to strengthen the tooth. These ceramic restorations help strengthen and reinforce the tooth. It reduces the risk of fracture and extends its lifespan, making it a predictable treatment. So does root canal treatment weaken your tooth? The short answer is yes, it does. But with conservative techniques during root canal, proper restoration afterwards, it doesn't have to cost you your tooth. The key is ensuring that treatment is planned well, done well, and the tooth is properly protected with a ceramic restoration. I hope you found this explanation helpful. If you have concerns about a tooth that may need root canal treatment, or you've had treatment and want to protect your tooth, simply DM us or give us a call. You can organise a consultation.